It is my absolute pleasure, to introduce Dr. Sandy Thompson-Hodgetts, who is an associate professor of occupational therapy and the director of the Supporting Kids Inclusion and Participation, or SCIP Lab, in the Faculty of Rehabilitation Medicine. Her program of research is focused on her approaches to enhance self-determination and support inclusion and participation of autistic children, youth, adults, and families in their daily activities and in their communities. So without further ado, Sandy, please take it away.
Okay, thanks, Lori. And I'm seeing lots of names here. I recognize people I saw last week and people I haven't seen for quite a long time. So that's really nice to see. So what I'm going to talk about today is two studies. So the first one I'll talk about is a summer camp study that our team did. And I chose to start with that one first because the second study I did present at the Autism Research Center Family Day. So I thought if some people also attended that, then they might want to sign off and go on with their day. So this was a pilot study that we did, our team. So Ashley, Lonnie, and I from Alberta, and then our colleagues, Melanie from University of Sherbrooke, and Steph from University of Oregon, and Jonathan from York University. And I'll just present the results from this pilot study. I will say that this study started pre-COVID, and then, as you can imagine, with summer camps, the first summer it was shut down. The second summer they had physical distancing in place, so you can't really look at peer engagement and inclusion. So this was a long-running study that had lots and lots of COVID barriers in it, but I still think that we have some really meaningful information. And so we know that social inclusion is a fundamental human right for everyone. Research also shows that autistic children are at high risk of being socially excluded. And this might be really common in community programs. And we think this is probably because of the nature of those programs. So they tend to be time limited. They often tend to be quite skill specific, things like learning to swim. The staff maybe aren't as highly trained in that regard because the children come and go so often. So community programs really do seem to be problematic in this area. And we also know, unfortunately, that autistic children are prone to some negative experiences more than other kids, such as bullying and ableist attitudes and discrimination. So that's sort of why we started with autistic children and the context of summer camps. And then when we look at interventions for autistic children, most of the interventions are focused on skill development within that child. So teaching them sort of neurotypical ways to act and be, or to fit in with their peers. So that might be something like social skills training, might be something like teaching functional play skills in the way that we maybe see the majority of other children playing. But that doesn't really address the areas of social inclusion per se. There are quite a few studies that have focused on anti-stigma or educational programs. A review just came out a couple of years ago that found 27 studies in school-based contexts, but what they found was over half of them were based on vignettes, and those that incorporated children with whom the peers were familiar were really peer-mediated approaches. So using peers to teach specific skills, and then they might have done something around peer engagement as sort of a secondary outcome. There's a couple manualized programs that are available that are anti-stigma educational programs that incorporate the same components as us. But again, they're not specific to a familiar child. They're storybooks or sort of programs that can be used with whole classes. And I think there's some really neat ones out there, but it doesn't address the issue of community programs where you don't have 8 two-hour sessions with the kids in their programs. So what we did is we took what the vignette studies have shown about what the necessary ingredients seem to be to lead to change in autism knowledge, autism attitudes, behavioral intentions. And then we incorporated that to see if we could use a really brief peer-directed educational intervention. And our main outcomes were social engagement, so peer-to-peer engagement, and inclusion. And we did this in summer day camp contexts. So before I tell you about our intervention per se, I did want to just talk about how we defined inclusion or conceptualized inclusion for this study, because I'm sure that you're aware that there are lots of different ways that you or others do conceptualize inclusion. I mean, these are just a few definitions out of many, many, many. But for us, what we were really considering was that sense of belonging and that acceptance of someone as they are, who they are, and without really trying to get skill change to be like their peers. So really about that sense of belonging, that was a key part for us when we did analyze our data. So our intervention, I realize that this slide is quite full, but based on other research, like I said, mostly vignette-based research. So in the vignette-based research, what researchers would do is give a scenario with a child without any labels, and then ask kids, would you want to play with this child? Then give a label of autism, but no other information. And then give a label of autism, but also some explanatory information about what that would mean. And what that research showed was really the label alone didn't help, but having that label and that explanatory information did lead to positive change in people's self-report of whether they would want to include or play with an autistic child. This was all based on survey. We did a review a few years ago where we looked at all the research that we could find on sharing one's autism diagnosis. And what that review showed was that the vignette studies all really showed positive outcomes, but the lived experience seemed to show contrary outcomes. So we weren't convinced that self-report on surveys was actually translating to improved peer engagement and social inclusion. But we went ahead with the intervention with all the components. So we always did use the diagnostic label of autism. We also talked about how that child would experience autism or a description and purpose of specific behaviors. So for example, in this slide, everything in yellow says, when he's excited, he might get really close to your face. We talked about favorite interests and activities, and we did that trying to create a context for maybe some shared interests or understanding, some strategies or activities that the peers could use. And then we did give them strategies to engage. So talking about when they got really close to his face, then the strategy that in this case, it was a parent. We always co-created these scripts with the child if they were able and a parent. And so they said, just calmly tell him or put your hands on his shoulders, you're too close, it makes me uncomfortable. So every child had a script that was quite specific to them. They were about 5 minutes usually to deliver, and then the intervention was usually 5 to 10 minutes, depending on if and how many questions peers had. It was delivered to the whole camp at once. So that was usually about a dozen kids, and then any camp staff that were there. We let them choose who delivered the intervention, and it was almost always the researcher who they did ask to deliver the intervention. And mostly that was, well, I don't know why, but one reason was for answering any questions. And sometimes there were questions, often there weren't, but sometimes there were. So for those of you interested in the methods, we did a 2-arm, so that's our educational intervention versus no intervention, parallel design, so at the same time, non-randomized trial. And that part was a little bit, we had a lot of discussion in our team because of course randomizing is more rigorous, but given the research that we came across in the disclosure scoping review, we didn't feel, given that there was so little known in this area, we didn't feel that we could tell someone that they had to go into the disclosure condition or the intervention condition if that wasn't what they wanted to do. So we did let our participants choose whether or not they did the educational intervention or whether they just went to camp without any intervention at all. If they were in the no intervention condition, we just told the peers and the camp staff that we were there looking at how kids played at camp over the week. So we did our recruitment. Then what we did is we videoed kids in both groups on the first day of camp. Then we videoed again on the second day of camp. And if they were in the educational intervention group, we went in sometime between then, usually the afternoon of the first day. And we did the intervention. And then we went again the fifth day of camp. And our hypothesis was in the educational intervention group that peer engagement and inclusion would increase over the course of the week because the children would have an understanding of that child and then be engaged with them more. And then over time they would see, or they would learn how great they were and continue to engage more. And we hypothesized that the opposite would happen in the no intervention group because peers wouldn't understand any of the nuances or unique behaviors of the autistic camper, and then increasingly sort of exclude them or not interact with them over the camp week. So we took video at all 3 times. We then coded that video minute by minute about the extent to which those peers were engaged with each other. That gives us really good information about if peer engagement's changing, but it doesn't tell us anything about potentially why. So on the last day of camp in the intervention group, we also interviewed the autistic camper and peers and camp staff, and that helped us understand the nuances of why. So these were our participants. Like I said, COVID did a number on us. This was far and away the most intense, like resource intense study I've done for the number of participants that we had. It was also, I will say, incredibly fun to go hang out at camps when I was able to do it. So we ended up with 15 autistic campers across 15 different camps. 14 of them identified as male, and the median age was 9 years old, and they were between 4 and 12 years old. We did do an assessment called the Adaptive Behavior Assessment System with each, well, we had a parent do it for each child. And for those of you that this is meaningful, our global adaptive competence score was 68, with a range of about 52 to 82. So we had some diversity in participants. So in the no intervention group, we didn't interview anyone because we weren't using the word autism at all. And so of course we didn't want to then go there for no reason. In the intervention group, there were 5 of the autistic campers we interviewed. Of the other 5, 2 of them didn't want to be interviewed, and 3 of them didn't use verbal communication. And in this study, we didn't accommodate for other ways of communication. We do in subsequent work, but in this study, we didn't. We also interviewed 34 peers and 18 camp leaders in the intervention group. And again, that was on the last day of camp. So this is an image, obviously anonymized, of one of the camps. And so what you can see is we had to get close enough that we could try and capture what that peer-to-peer engagement was, but also be far enough away to not disrupt that peer-to-peer engagement. We did do a feasibility trial the summer before we started data collection, where we had video cameras. And what we ended up doing for these 15 kids is we held an iPhone, you probably can't see, but we just kind of cradled an iPhone in our arms and videoed, and the kids didn't even notice us. I mean, I think everyone walks around with phones and they have so many adults at camp in their lives. So we really felt like we weren't disrupting the natural peer-to-peer engagement. Within each camp, we made sure to record the same activity at the same time of day, just to try and control for any of those other potential confounds we could. And we let the camp staff choose those activities. So we had games for almost half of them, snack time crafts, and this was the baking camp. And then our definition of joint engagement was about direct social behavior to one another that involved reciprocity, connection, or collaborative goal. Offer objects, have a conversation, exchange turns, We had Steph on our team. Stephanie Shire has done a lot of work on what's called the POPE, the Playground Observation for Peer Engagement. And so she came up and we did pretty extensive training on that tool and how it evaluated peer-to-peer engagement. So that's what we used. And then we also had 2 coders for one of the 3 videos for every child, just to make sure that we were sort of staying on the same track with how we were coding things, and we had really high inter-rater reliability. Okay, so the meaningful part. So what we found, we did find that the groups, can you see my mouse, Lori, if I move it around? Okay, so on the first day, the first thing we did was make sure that they weren't significantly different, because if they were already starting different, then we couldn't really say anything, and they weren't. So there was no statistically significant difference on day 1. So we were able to go ahead with our data. What we found was in the educational intervention group, there was a significant improvement between day 1 and 5. It was trending on day 2, but this difference wasn't significant. But by day 5 it was, and that was not the case in the no intervention group. And then we also found on day 2 and day 5 that there were differences between those educational intervention and no intervention groups. Keep in mind, very small sample sizes, but this is, for those of you that like the terminology, this is a medium effect size and this is a really large effect size. And so that basically tells us, our data suggests that there's clinically meaningful differences going on between the camps in which we had the intervention and that in which we didn't. So that was encouraging. And so then our qualitative data, we feel, really kind of helped us to figure this out or unpack this a little bit. So for our interviews, we asked kids things like, do you remember what autism means and what it means for Bobby, your peer? And then do they know, did you know that your child was on the autism spectrum, or your peer was on the autism spectrum? Did that change how you played with them, and how so? So fairly specific, simplistic questions, and we got a lot of really rich data. With the camp staff, we asked just, do they think that sharing that diagnosis and the information influenced how peers interacted with them, and if so, how? The interviews were done by me, a postdoctoral fellow, or a couple of OT graduate students who were trained. And then we also did reflexive journaling throughout data collection and analysis. And so the one thing that we did make sure to do whenever we were at camp was also document just our subjective impressions of the type of interaction that we're seeing, and whether or not we really think there was any, how other peers were really including and engaging with that child. And that was important because we were there for longer than our 10 to 15 minute video clip. And so that those data we also looked back on in our analysis. We did what's called reflexive qualitative description. I won't go into detail, but for those of you who are familiar with different qualitative approaches. And we had 3 themes that we came up with from the data. The first theme was very, very prominent. It really aligned with all the other research from the vignette studies and so on. And that was really a change in behavioral attribution. All the peers talked about this. Some of the camp staff talked about this as well. And basically it was an increased tolerance for behaviors originally seen as atypical or socially undesirable, because they were reframed as part of that child experiences autism, and not that they were malicious or they just were seen as less undesirable because it was attributed to autism. And so some of the quotes, so a peer said, if you knew he experienced autism, well, we said in the interview, would you still think spitting is kind of gross? And the peer said, no, because sometimes people just can't control. Or another peer said, well, he's still the same, he's just a little bit different. And then a leader said, people know he isn't trying to be annoying. And words like annoying, you'll see in subsequent themes, are actually quite important. Our second theme was that it was easier to relate to him, a safe place to start. And this was really peers and camp leaders' appreciation of a starting point to engage with the camper with autism and a safe space to talk about autism. So they felt like that education session, even though it was brief, 5 to 10 minutes, it gave them permission to ask questions and then open dialogue if they didn't understand something. It also really gave peers in particular talked about a place to start the connection. So, oh, I knew that he also liked this. So then I went and talked about that. Or I went and took his hand and took him to play this with us. So they really appreciated that. So a leader said it kind of lets the kids be like, oh, it's okay to talk about it. Like we can talk about this. Like I can ask questions, not be judged or told, you know, you shouldn't ask that. And a peer said, we can just ask about the stuff he likes, and then we can just start a full conversation with him. Or if you know that he likes something, especially if you know that he likes something just like me. And then our final theme, so kids were nicer to me. That was a quote from one of our autistic campers, but the theme actually did cross all of the stakeholder groups. So autistic campers, peers, and camp staff. And they talked about perceptions of increased inclusion, but we've labeled the theme misperceptions, and I'll explain why. So that word I think is really important. So lots of peers and lots of camp staff talked about increased inclusion following the intervention, and they did use that word inclusion on many times. But they didn't talk about those relational aspects of belonging. They really talked more about tolerance, if you will, more back to that behavioral attribution piece. There was still quite a bit of othering involved, some portraying sort of a tragedy lens to disability. So for example, it doesn't mean that you got to be friends with him. It's just good to learn about. Just because he's different doesn't mean we should exclude him. I also love interviewing kids because they make up words. Or one of the camp leaders said, I think these kids just really understand that he's the way he is because of autism. Like they almost have something they can place on it. They're trying to be more inclusive now. They might think, oh, maybe he's weird. But when they know it's autism, it clicked for them. Or a peer said it changed how we interacted with him. He was nice for the most part. Sometimes he did wrong and I didn't do anything about it because I didn't want to make him sad once I knew. So in conclusion, a really brief educational intervention. And just to reiterate, like we were 5 to 10 minutes, and the other storybook type programs that I mentioned earlier that I really like, there's one that's one session, but it's still, you know, a couple hours. And then all the others we could find are multiple weeks. So what we found is just this really brief educational intervention that included the label and the explanatory information and the strengths-based strategies might be a simple way to improve understanding of difference and unique behaviors and improve that peer-to-peer social engagement with autistic children in community programs. It doesn't have to be researchers to do it. In fact, we had a couple of our parents reach out to us after saying, hey, we've taken the script and we're doing it at school this year. But although they use the terms inclusion, that it really doesn't reflect that sense of belonging. And that's, I mean, that's not surprising given the context and given what we know about inclusion. So for people who want to share their diagnosis, this might be a really easy thing that they can do to sort of improve some of those engagement and understanding outcomes.